We shift over now to South Africa, where the country with the highest number of COVID-19 cases on the continent. With me now is Zola Saphetha. He is the Secretary General of the TUI-PS&A, the Trade Union International Public Service, and allied unions. This includes frontline workers fighting the coronavirus in all continents, and he's also the General Secretary of the National Education, Health, and Allied Workers Union in South Africa. Thank you for joining us today.
Thank you very much to you and the viewers.
And start us out with a general overview of the response to the COVID-19 there in South Africa. What have frontline workers said about working conditions during this time?
It's a sad situation across the world because frontline workers are subjected to conditions that are to risk their lives without adequate protective gears for them to be able to save their lives before they save the life of the world. So here in South Africa, we're confronted with a serious shortage of the PPEs to help these frontline workers to be able to respond. However, there are discussions between unions and the government in a manner that seeks to bring more PPEs to save the lives of frontline workers.
Absolutely. And how about working people in general? What has the government done in the way of keeping people fed, as many activities have been restricted?
Our government is in touch with the population. There are always addresses that are made. Currently, the president of the country had announced 5 phases, which characterizes the nature of the lockdowns. Currently, we are at level 5. We're coming to effect 1st May, will be at level 4, where it's going to open up economic opportunities so that at least there are economic responses to the plight that we're confronted with. And there are stages, and ministers currently are announcing those stages in terms of how each sector must return back to work, but taking into account that we are still under lockdown, but also the fact that the virus is real. So there are measures, they still remain, and restrictions, they still remain, but there's a little bit of relaxation now just to respond to economic pressures that they were confronted with.
Okay, so here in Latin America, the quarantines continue in many countries. People have been without income for some 6 weeks now in several places. I know it's perhaps not as long in South Africa, but it's looking a little bit unsustainable in many countries here. We did see some word of a bit of unrest in places like Cape Town. Is it a concern that people may lose patience before measures are lifted?
Certainly they will, because the nature of the policies that government are having are neoliberal policies, which really places austerities over the lives of our people and also cut on social spending. That's why now we are confronted by these challenges, and we are found wanting because we have never paid attention to the whole issue of health system in a manner that now is able to respond. And certainly when people are under pressure, they can't move, they don't have bread on the table, will be forced to really undermine and also revolt against the pressures that they are subjected to, with their quest to find something to eat, because that's what we're confronted with now.
Late Sunday, we were pleased to see the arrival of a Cuban internationalist medical brigade there in South Africa. Henry Reeve specialized brigades are now in 23 countries worldwide, but Cuban medical cooperation can be seen in about 60 countries. How were they received?
Firstly, as NEHAWU, we're thankful, and we've been making that call to our government, including us as the family of TUI Public Service allied workers, that Cubans, given their expertise on health, needed to be spread around the country to provide intervention, and we're grateful with that. And South Africans are very excited, and they receive a warm welcome because of our history with them, but also because of their ability and capacity to respond to any forms that are confronting the health situation of human beings. So we're grateful, really, and that demonstrates that the way to live is a socialist way, as opposed to a capitalist system, because capitalism has proven beyond reasonable that it can sustain itself, and Cubans are demonstrating that.
Zola, you mentioned a word on the history of cooperation and friendship between South Africa and Cuba. Give us a little bit more about that?
You will recall that the late President Mandela and Fidel Castro had established a relationship a long time ago, which was a relationship born out of the relationship of Cuban political structures together with an ANC, culminating in a democratic elected government. And as a result of that relationship, they then decided to invest more on health. That's why there are a number of young people here in South Africa who are taken to Cuba to be trained on medical qualification. And we have been observing groups coming back from Cuba and also providing a preventative kind of a health system that is responsive to the nature of the disease, given the fact that South Africa is characterized largely by poverty. So we are quite happy, and we want to keep that relationship of our former leaders and heroic leaders like Mandela and Fidel Castro.
Absolutely. And you also mentioned earlier the possible reopening of some industries and schools. What do you know about that?
Currently, we, as trade unions, we are expecting to be consulted by ministers because the president directed them to do so. And the president said, as from 1st May, there has to be a clear understanding and a consensus agreement that spells out how people must return back to work. We are still now in that process of consultation, and hopefully these ministers, particularly in our sector, they will come back to us and have that kind of a discussion, so that because our primary responsibility is a protection of workers and also their safety in terms of receiving their PPE, so that they can be able to exercise their ability in saving the lives of our people.
And finally, Comrade Zola, we'll be celebrating May Day this Friday. What are some of the demands of workers this International Workers' Day?
We want we want to have access to health care system, so that the health we have system doesn't serve only the rich, but also it serves everyone else. That's a primary task. But secondly, the fundamental demand we're making is that we call on government to really reconsider their neoliberal policies in such a manner that they produce policies that are responsive to social development, so that society can benefit out of the economies that we're producing as different nation states.
Thank you so much. We've been speaking to union leader, Comrade Zola Saphetha. He is the Secretary General of the Trade Union International Public Service and Allied Unions, as well as the National Education, Health and Allied Workers Union in South Africa. Good to speak to you today.
Thank you very much.